Joining me now is Zubin Damania. He is the founder and creator of ZDoggMD Industries. Fascinating. All right, Zubin, welcome. What in the world is, first of all, ZDoggMD?
So ZDoggMD, by the way, thanks for having me on the show. ZDoggMD is a character that I created around about 2010 as a physician. I was at Stanford for about 10 years and just saw all the failures of our healthcare system to do its primary job, which is actually keep people healthy. So I created this character as a way to kind of, it was a kind of a cry for help. I try to unleash my inner weird, creative, Weird Al type character and started making videos on YouTube. And the reason I called it ZDoggMD is it has 2 G's because one is necessary but not sufficient to be a gangster, and also because Stanford wouldn't know it was me, even though it was me on the screen.
Yeah, I'm pretty sure they know now. So they have been viewed hundreds of millions of times. So it's amazing. But let's talk about the core of the issue that you were trying to bring attention to. First of all, you talk about Health 3.0, and I want to understand what that is. But let's back up. What's healthcare 1.0, 2.0, and what do you want in 3.0?
So a good way to think about 1.0 was that old doctor-patient relationship from the 20th century where you knew your doctor. It was this sacred human relationship unfettered by bureaucracy and intrusion, also unfettered by science and thinking about bigger populations and thinking about equity and thinking about treating people the same and non-hierarchically. So in that 1.0 world, we saw a lot of beauty, but there was also a big struggle. So 2.0 was the response where business and industry and government came back and said, you know what, medicine's a business. It's not about these cowboy doctors and their human relationships. Let's use measurements and electronic cash registers, i.e. electronic health records, to measure and quantify and adjust the assembly line of healthcare. And in Health 2.0, that's where we really are now. So many of us feel like commodities, especially the caregivers and the patients together. It's still expensive. It still has terrible quality compared to the rest of the world. And even the rest of the world struggles with the same problems we do. So 3.0 said yes and to the beauty and relationship of one without the paternalism and all that garbage. Yes to the science and the data and the technology of 2 and the process improvement and the safety science. But the new emergent is repersonalize it, make it team-based, real outcomes that matter to patients, bring the heart of it back and use technology to enable the relationship, not to obstruct it. And then you have something truly transformative. The unique patient at hand is cared for as well as his or her position in the broader picture of their zip code and their environment and the social determinants of health and all the other things that we know have a bigger impact on our health than a doctor sitting in a clinic.
So ZDogg, I did want to ask you about this one stat that I'm amazed by. Only 27% of a doctor's day is spent on clinical FaceTime with patients. That can't be right, is that right?
You're right, it can't be right. It's probably less than that. I think that's probably an overestimation. Most of our time is spent clicking boxes in an electronic health record that is really a glorified cash register and government compliance tool. It's not a care delivery device. And so we spend all this time being our own data entry clerks so that we can get paid because the insurance companies won't pay us, Medicare won't pay us if we don't click the right boxes, instead of the eye-to-eye contact with our patients. And I'm sure you've been to the doctor where they're looking at a computer rather than talking to you, and you feel like a number. Well, you know what? The doctors feel the same way. I felt like I was entirely expendable and replaceable as a raw material in an assembly line. And that has to change before we're gonna fix healthcare.
So I'm curious about all these in your lived experience as a doctor. What's got more red tape, private insurance or Medicare?
You know, it's funny. Private insurance takes its cues from Medicare. Medicare feels wonderful because it covers people and it's actually lower administrative overhead, but it sets the sort of prices by fiat, by a committee of specialists and other people that set the prices, and then private insurance kind of ties themselves to that. So going through this administrative bureaucracy of trying to get paid by private insurance is really hard. Getting paid by Medicare is easier, but it actually has its own unique problems. So the answer is probably a mix of kind of getting rid of a lot of the administration, finding the science of what actually works, and then paying frontline caregivers to actually just do the right things for patients and getting outcomes that actually matter. And it seems really complex, but you can actually simplify it to that. So the red tape is all over the place right now.
So Zubin, let me press on that. Medicare pays less than private insurance. Is that to doctors? Is that true?
In most cases, yes.
Okay, and roughly how much less?
So it depends on the location. So it varies regionally. All healthcare is local, but it's something like 60% in some places, sometimes less. And many physicians wouldn't be able to make a living purely on Medicare with their current expenditures. Now, of course, most of what we do in medicine is unnecessary. I'm going to repeat that. Most of what we do in medicine is unnecessary. So we're paying for things that aren't even needed, that are probably over treatment, over testing. So if we actually got rid of that, we could actually lower costs and actually do it for less. So I think it's less about how much we're getting paid than are we paying for the right things.
Yeah, I just wanted to get that on the record because we had Eric Bolling from formerly of Fox News and currently of The Blaze get into a debate with us a couple days ago during the Miami debates. And he said Medicare pays doctors 11% of what private insurance pays them.
It really, yeah. And again, I won't get into the politics. I'll say this: there's truth on all sides of the political spectrum on healthcare. There's some truth; it's all partial. No one has it all figured out. It's not, again, so much about how much we're paying, but what are we paying for? If we get the care model wrong, it doesn't matter whether it's cheap or expensive. It's a waste.
Yeah,
you have to fix that.
Although Bolling is wrong. Okay.
Yeah, and 11% sounds low. That sounds really low.
Yeah, of course, it's preposterous.
That nobody maybe think of Medicaid. Medicaid can get that low sometimes, but Medicare, no.
No, yeah. Okay, so then I want to talk about one other thing squeezing doctors, and here I'm a little vague, and that's why we have you on, of course. So there's the pressures that you get from the filling out the paperwork, and you've got, we talked about all that. But I feel like doctors are also being squeezed by other factors, hospitals and other corporate forces, but I'm not sure. So what are some of the other forces out there that are squeezing you guys?
Oh, it's a great question. So yes, the corporatization of medicine has turned physicians from independent practitioners into corporate employees. Now, that's not always bad, because in a good collaborative, physician-led corporation, you can actually get that lift from your teammates in a way that you could never get in a private practice. But unfortunately, in many organizations, it's about the bottom line, which is, can we make a profit? Can we squeeze as much productivity out of our doctors and frontline nurses and respiratory therapists, everybody else, as we can? And then it becomes a horrible, dehumanizing experience for clinicians who went into this to help people. I have this sort of rant that I get on, that we're not burned out. People say, oh, physicians are burning out. It's not burnout. That's victim shaming. It's moral injury. We are good people forced to be complicit in horrible acts that hurt our patients, meaning we can't care for them. We can't give them, we don't have the tools, resources, and autonomy to care for them. And we have corporate overlords who care about only money. So as a result, it hurts us inside on a moral way, and we manifest that by emotional exhaustion, cynicism, poor accomplishment, all the signs of burnout. So we have to fix that if we're going to save this generation of physicians and nurses and others, to provide the care that we know this country deserves, but we haven't been able to do yet.
So I'm very curious about that, Dr. Damania, because so who are specifically the corporate overlords? Who are the corporations that doctors interact with or report to?
So you have obviously the old legacy insurance companies. You have big health systems that are contracting with the insurance companies. You have the pharmaceutical industry, which is a big legacy system of corporations. Then you have the government, which actually funds roughly 50% or so of healthcare overall, and that feels like a corporation when you're trying to deal with it. And so it's many of these things. Then you have medical devices and all these other things. But in truth, I've met wonderful people at all levels of all these entities, but they're in a system that's so intractably related to, we gotta hit next quarter's numbers, that they can't look at the big picture, which is, you know what, you can do well financially by doing good for patients, and it makes it affordable in a way that we can cover everyone in this country. And we can get there, but we have to look beyond the short-term thinking that we're really known for in America.
Yeah, I think you put your finger on something that a lot of people also have in their gut, which is absolutely based on logic, which is that whenever you're working for a corporation, whether you're working at the cash register at McDonald's or you're a doctor, they will maximize profit. That's what their job is. And one of the ways that they maximize profit is by paying their employees less or paying their providers less. And so doctors are being squeezed. It's not, you're not imagining it. And that is so that corporations can maximize their profits, which is logical, but one that we should be careful about if we're representing the people of America. Okay, so in the time that we have left, I know you have a little bit different take than others do. How do we fix it?
So the way we fix it is first we have to fix the care model. We're the only country that really values our specialists above our primary care preventative folks. So first fix primary care. Instead of 5% of our healthcare dollars, it ought to be 10 or 15%. We did that with our own clinic in Las Vegas called Turntable Health, which we ran for 3 years. We went out of business because nobody else was doing what we did. We weren't plugged into a bigger ecosystem, so we were alone and too early. So the idea is fix primary care, prevent disease, make it team-based and collaborative. So health coaches drawn from the community they're caring for that care for these and understand the social determinants of health, that your zip code is more important than your DNA code in your health and more important than the doctor or anything else. Focus on that, then you can control the downstream specialist spend and the admissions to the hospital. Make hospitals a cost center rather than a profit center. It should be a failure to be admitted to the hospital. Control price gouging like what air ambulances are doing to people, and surprise balance billing. And if you do all that and you value the caregiver side of it too, so in other words, we take care of each other because we need to be safe and healthy and mentally stable before we're gonna care for others. If you do that, it's gonna shrink overall costs, you're gonna improve outcomes, and you're gonna be able to pay for it in any mechanism you want, whether it's employer mandate, whether it's a government single payer, it doesn't matter what it is, you'll be able to afford it and it'll have good outcomes.
All right, everybody check out ZDoggMD.com, although I think a lot of you already have. And so check out the videos as well. Zubin, Damania, thank you so much for joining us, really appreciate it.
Thank you so much for having me.
2 easy ways to follow the Young Turks. One is hit the subscribe button down below, then you're a TYT subscriber. And second is ring the bell. And when you do that on YouTube, you're notified of our videos.